All right, guys. Almost 10 or no?
I think we can go. Yeah, I think we're good. 0 hour.
Good. All right, so we'll do well, first of all, good morning, everyone. Good morning.
Morning.
Morning, Pat.
Morning.
Scott, yeah.
Morning, Pat.
So, my name is Fidel Barrantes. I'm one of the transplant nephrologists with Amazing Associates, and also I'm the medical director of the Pancreas Transplant Program at Recipient Hospital. I volunteer for the University of Kidney Foundation, and I currently serve as the board president. And we're here today to start a series of webinars. We're calling this, how to find a living kidney donor, and we are here with Pat and Scott.
Good morning.
Morning. We are previous. They were dialysis before, they had kidney issues, and they have to look for a living kidney donor. Some few housekeeping notes here. We're going to run this conversation for at least 40-45 minutes.
We like to talk.
Yeah, exactly. Yes, let's call it talk.
I like to talk.
And then we are going to have at the end 10 to 15 minutes questions. Okay, and we're going all the questions. Please put it in the chat, and then we are going to review the questions at the end. First of all, I think let's kind of understand more. We're talking about kidney failure. Is that right?
We are talking about kidney failure. That's right.
Exactly. Well, kidney failure, unfortunately, chronic kidney disease, which leads to kidney failure, is prevalent in America. Well, what I mean prevalent is out of 7 people, 1 gets affected with kidney disease. And the sad part is 90% of those affected with kidney disease don't know it. So they know it at the end. Many times patients show to the doctor when things are very advanced. So once the kidney disease progresses to the end, then we get that to the stage of kidney failure. And I understand that I want this kind of learning story a little bit more. Pat, so how did you begin the journey of kidney disease?
Well, it started when I was young, when I was 25. So that was a few years ago. And I wanted to join the Air Force and be a pilot. And everything was looking good. And I took the physical, and I found out I had protein in my urine. And because of that, I wasn't able to join the Air Force. But the silver lining of that was that I went to the doctor, and then I went to a kidney doctor, and they told me I had chronic kidney disease. And that doctor at the time predicted I would be on dialysis in 5 to 7 years. And at that time, I didn't even know what dialysis was. So I looked it up and I found out, oh my gosh, this is bad. But the doctor also told me, watch your salt, watch your protein, stay in good shape, and keep your blood pressure down. So my wife and I, we changed our diet. I tried to exercise more. And I think by following the doctor's orders and God's grace, the kidney disease progressed slowly. And I didn't have to go on dialysis till I was in my 60s. And at that time, I went on hemodialysis. I was on dialysis for 3.5 years. And I was in center at first, and then we did it at home. And then I got a transplant. And so that's kind of how my disease progressed. Dr. Barrantes said 90% of the people that have this don't even know it. And when I was 25, I was feeling great. I had no symptoms except for that protein in my urine. And without that medical test, I would have never found out. So it's good to get your physical every year. Get it checked out.
Well, great story and long story. I'm glad you made all these changes early on in your life. How about you, Scott?
I've been a type 1 diabetic since I was 19, and I'm still on, and that has not gone away. I'm completely the opposite of Pat in that I knew that there were some kidney issues, and I just kept living my life. I ate what I wanted. I exercised when I wanted. I worked in the movies. I was kind of a movie cowboy kind of thing. And similar to Pat, though, somehow, I think God's grace is a good term for it. I had a long plateau where my kidney function had dropped, but for almost 20 years, I was at about 20 to 25%. And then, I mean, even the doctors would say the same thing, like, what, how, you know? So I had a long period there. And then when it finally started heading towards the end stage, it was very quick, very scary. And for a while, I was doing home dialysis, PT dialysis, and was still working on shows. And that ended up not working out for me eventually. And then I switched to hemo, and I remember a nurse talking to her about it. I would go at 5 a.m. and have my dialysis, my hemodialysis, and then go work on a movie for 12 hours.
Wow.
And she said, you know, every time you sit down, your body is basically running a marathon. And eventually that caught up with me, and I had to stop working. And that's when I started realizing, you know, I needed to really do something about it.
No, I echo your stories. No, dialysis is hard. Is, you know, I see the suffering the patients every day. You know, a common story I get is, I go to dialysis, I feel exhausted, tired, but the day of dialysis, and then the next day you are pretty much trying to recover, and then you go the day after again, you know, to the same process, and it's a constant, you know, roller coaster of feeling a little bit better, but then again worse, and then you just go on that cycle. So the good thing is we have a transplant. We can have a transplant. The transplant really can help to solve this problem, to fix this problem. Now, when we talk about transplants, we have to have a transplant from a cadaver. If you go to a national list, or you have a kidney from a living donor, you know, somebody who can donate a kidney while they are alive. And the results are completely different in terms of, you know, for example, let's say how long it's going to last. You know, a kidney from a live donor can last 15, 20 plus years. A kidney from it comes quickly, you know, there are less complications, you know, surgery goes more predictable. And there are many advantages that usually we see. And I want to just kind of learn from the story. So you were on dialysis, and what made you think that you want to get a transplant? And then when you learned that, why did you choose to find a living kidney donor? And we'll start with you. And then
Okay.
Well, my nephrologist told me that I needed to start dialysis, and you know, started me off on getting approved for a transplant. And he said, you know, you definitely want to get a transplant so you can live an active life, but it takes time. Yeah, you have to be approved. You know, you have to go through lots of tests and stuff. And so I listened to what he said, and then I, you know, I wasn't sure, you know, because he had said, you know, a living donor transplant is better. And so I said, well, how do you ask someone for a kidney? So I happened to have a friend that had a kidney transplant. And so I went to my friend Adam, and he took me out to coffee. And I said, Adam, how do you ask someone for such a big gift? And he said, you don't ask, you just share your story. And the people that would like to donate just say, you know, what can I do to help?
Right. It's like they kind of come to you.
Yeah, right.
And the more people who hear that story, the more people may end up saying, you know, I'd like to help. That's such a good point.
Right. There are people out there that want to help. And they can't if they don't know what the need is. And so getting our story out there gets the need out there, or gets the story of our need out there. And then people like that can, you know, they want to help, and they can respond with, what do I need to do? So you know, listening to my doctor, talking to someone that's been there really, really helped me get started.
For me, I kind of found out about living donors accidentally, like online, like I saw it on the internet. When I went in for my initial evaluation, once I got on the transplant list, and that's obviously step one for anyone suffering from end-stage renal disease, is get on that list. My understanding was I was just kind of trying to stay alive until someone who had my blood type died. And that didn't feel very hopeful to me. And then I started looking into the grim statistics of being on dialysis, where it said within 5 years, about 50% of people on dialysis won't make it. And the wait, as I understood it, was 3 to 5 years. So I became desperate, thinking I kind of need to save my own life here. What else can I do? And I looked up transplant options and came across NKR, or the National Kidney Registry. And that's when I started realizing the better outcomes, the shorter wait time, the fact that you can plan for it. You don't have to drop everything. And that the kidneys start working right away. I mean, it was kind of for me, a dream come true. I didn't get that message from the beginning. So once I found out about it, I was all about trying to make a kidney transplant.
And that was your goal.
It was like, I even said to myself, I may not make it a year because I was type 1 diabetic. And as you said, you put type 1 diabetes together with, you know, it's pretty grim. I made it my goal within a year. I need a new kidney.
Wow. So you were racing against time.
That's how it felt. I guess the other thing I would say that felt so good about it was, for me, I went from feeling like I'm just waiting for the system to save me, and it probably won't, to I'm doing stuff. You know, I'm being active about it. That felt like I had more autonomy, I guess is what I'm saying.
See, I think that's very important, because just to share some grim numbers. If you are on dialysis, from 100 patients who start dialysis and have diabetes, about 40% or 40 of them will not make it in the first 5 years. If you compare dialysis or kidney failure and cancer, it's almost comparable with advanced lung cancer or advanced colon cancer. Breast cancer, prostate cancer is much better compared to being on dialysis. So just to have an idea, unfortunately, kidney disease is silent. People don't know much about it. And there's not much a lot of publicity, but the mortality is extremely high. And we do have a cure, which is transplant. The transplant is available, but again, as you rightly pointed out, the first step started with getting in the list. If you're on dialysis, first step number one is you have to get on the list, to be eligible for these programs, and discuss with your nephrologist how to get to the list, how to get referred to transplant centers. And once you get on the list, then you can explore with transplant center. If you're in New Mexico, you have Presbyterian, you have UNM, and discuss with your providers there. Okay, how about getting a living donor? That's what I think it's really what we're all about.
And both places have living kidney coordinators, right? Because I found that incredibly helpful in trying to figure out how to get going.
Yeah. So I guess now we understand that. Okay, so you are on the list, and then the degree and statistics of being on the waiting list, because being on the waiting list doesn't mean that you go to get a transplant. So only a fraction of patients who are on the list get a transplant. So currently in the U.S. there are about 580,000 people on dialysis at this moment currently. So imagine you have a stadium with 500,000 people there. Only 30,000 of them per year are going to get We do only 30,000, transplant per year in
Those
the
are,
US.
those are long odds.
Right, exactly.
Wow.
So I think, I think that's when you said, leaving the system to find your kidney, may not be the most optimal idea. And I think that being more proactive and trying to overcome the barrier. So I guess, one of the questions I have for you is, for both of you, I frequently tell my patients, okay, let's look for a living donor, and they look at me, confused, how can I ask somebody to give me a kidney? This is not like I'm getting a coffee, I'm getting, a burrito, it's a kidney. So how do you guys do it?
Well, I had mentioned I went to my friend and I said, how in the world do you ask someone for a kidney? I mean, that is such a big gift. And he said, like I mentioned earlier, you don't ask, you tell your story, and the people that want to donate will say so. And so it's just getting your story out. And matter of fact, he had said his mother was a big advocate for him. She helped to get his story out even more. So it's good to have a friend and an advocate, maybe a family member, maybe a friend, maybe your spouse, that can be your crusader to help you get that word out. And you have to do it yourself too. And I had mentioned I use the National Kidney Registry microsite too, like Scott. And I had this coach, and she said, "You need to let people know." And I said, "Well, I don't really like talking about myself." And she said, "You just have to do it. Otherwise, people aren't going to know the story, and people that want to donate won't be able to have that chance." And so she really encouraged me to get out of my comfort zone. And, it was uncomfortable, but it helped get my story out, and people started to hear it. I told one gentleman, and he said, "What do I have to do to donate?" Because there's just people out there with the spirit that they want to help, and but they can't if they don't know your story. And you got to get out of your comfort zone to tell your story.
Yeah, it can definitely be like an overwhelming thing to hear, you need to go find a kidney, okay? So get after it. And you're kind of thinking like you with a pulse. You have two kidneys, you only need one. Like, I'll take the one on the right. Do you know what I mean? You're just like, and for me, the way I started was going to NKR, National Kidney Registry. And there I found a whole bunch of resources that would automatically help to get the word out there. But what I had to do first, they offer a free website that Pat was referring to that you would use to kind of put some pictures up of yourself and basically tell about your need. And you're not trying to like earn the kidney. You're just sharing your need. It's not like you're pitching to some producers and they're like, "We're going to make that movie." It's just letting people know, like Pat was saying. And it's hard at first. And having a friend or an advocate who can help you with just that first step, even if that first step is just an email to friends, but beginning to get the word out. And then the other thing for me about NKR was they sent business cards that have, I'm just going to show you some of my merchandise real quick.
You know what to sell it, no?
No, not at all, because I don't need these anymore because I got a kidney, but this is Snack, which then became our logo for Need a Kidney. And they developed this QR code that is on these little business cards. I also made yard signs, which led to a lot of people knocking on the door. There's 100 different ways to get the word out, but we're just talking about how you initially get started. They give you these cards, which I would hand out to strangers. I mean, I became my wife has always said you'd be a great salesman, and for me, the job was to find a kidney within a year. So, yeah.
Very inspiring, stories from both of you. And we live in New Mexico. New Mexico is rural, and I go many times to rural. So I go every month to rural to see patients there, and I see a struggle. And I hear from my patients, I live, somewhere, in a big place. How can I go around and ask for a treatment in a small place there's only a few people around?
Mm.
What is your advice for patients who have renal failure and live in the rural communities, and they, perhaps they are not active in social media, and so some practical steps that you can recommend?
Sir.
No, you go ahead, Pat. I've been yakking.
One of the ways that I did it, I think you start small with the
Mhm.
people that you know. I went to my church and I talked to one of the pastors, and he said, let's get you, we'll put your need out on the prayer chain. And and I was even a little talking about getting out of the comfort zone. I was a little reluctant to even bring it up to the pastor, because there's people in church with cancer and lots of other needs and stuff like that. And I didn't really want to make my need the biggest need, but he said, no, this is important. There's people here at church that want to help. And so he got me on the prayer chain, and got the word spread around. And a couple people from church tried to donate. Unfortunately, they weren't able to because of medical things they were going through, but at least it got the word out, and people had a chance to volunteer and try and go through the test. And they found out things that they need to work on anyways, which was good. So even though it didn't result in a kidney for me, it helped them because they got a really good physical,
Right.
and they found out some things they didn't know. And so that's, going through your church, going through your family, your friends, is a good way to start.
Yeah, I think that's such good advice, because you can get so overwhelmed. That first of all, how important it is, but also how personal it is. It can feel very awkward. So starting with one trusted friend, family or not, if you feel like you're not that good about technology, again, asking for help, you'd be amazed at the people who step forward because they want to, and how they can help start to slowly spread the word. And then from there, it kind of can spread on its own. So I think step one is kind of getting over your own embarrassment or the shyness about it. I've heard a great comparison about it too, which is if you're looking for a job, you go into a lot of different interviews and you kind of you tell your own story, and you might do 100 interviews, then you might get one job. So it's
that's a good point.
That's
a great comparison. Actually.
Yeah.
Yeah, you're right. Yeah, because we all go through that phase.
Yeah, everybody's, I think,
Yeah.
has tried to apply for a job, and it's a little bit like that. And then the amazing part about it is the response that will come. It's not all on you to figure out how to make this happen. It becomes a community thing, and that community can be very small. I think the other thing too, without having to do a website or having to pursue anything big like that initially, is just get with your living kidney transplant coordinator, so that when you do tell your story, you can say, you can call my coordinator and she can give you more information about it, right? Then it's not all on you to explain all that stuff. And so,
I told my neighbor,
I love
the
this.
gentleman that lives behind me, and he is just the neatest guy. But right away he said, I'll do it. He was just one of those people that wanted to help. He's such a kind person, but it turned out he couldn't because he had cancer previously, within the last 5 years. But his spirit was he wanted to help. And so there's just people like that out there. And it may take, 10 or a dozen people trying to be a donor, testing to be a donor before one sticks. And so it's good to get your story out there, spread it wide, keep spreading it out. Even if someone says, I'll be a donor, keep looking for other donors because you don't have a donor until they're bringing the kidney over to your operating table. So it's good just to persevere and keep trying.
And I think,
I'm just gonna say something real quick. I keep looking at my phone because it has my blood sugar on it. I'm not ignoring what's going on. I'm just making sure that my blood sugar is okay. I just wanted to say that anyway.
very good, no, thank you. So I think, I want to comment on what you just said, Pat. Having only one person to donate, sometimes it's not enough because, typically from 7 or 10 donors who come for a given patient, only one gets approved. We always find some health-related issues. And remember, donors are very highly evaluated. The transplant center have 2 different sets of teams. The team who evaluates the living donor is independent of a team who evaluates the recipient. So you have to keep that transparency, and donors are evaluated different history, lab tests, imaging. It's a whole committee who decides whether those are approved or not. One of the things that I always hear from my patients is, I have kidney failure. I'm already sick. Why in the world I'm going to ask somebody to donate kidney and make that people or that person at risk to be sick in the future? How do you approach that? What would be your advice? Or how do you think about those things?
Oh, yeah, because, well, first of all, to be a donor, they put you through a barrage of tests, and they want to make sure that you are absolutely healthy enough to live the rest of your life on a single kidney. I have a friend that donated his kidney, and he's a very healthy person, and he rides his bike tens of thousands of miles across the country after he donated a kidney. There's another group of people, there's a group called National NKDO, National Kidney Donor Organization. And they have a group of people that are all donors. And some of them run marathons, some of them, a group of them climbed Mount Kilimanjaro in Africa. And so, they only take the healthiest of people. So like Dr. Barante said, 7 or 8 may try and maybe only one passes because they want to make sure they're healthy enough to live the rest of their life.
Right. And I think too, the thing that's so amazing about it, I remember seeing a statistic when I was first starting to look into it that said people who donate a kidney live 20% longer on average than the rest of the population, right? And I'm like, oh, it's a benefit from donating. And what it is those folks are that much healthier than the rest of us. And it really put my mind at ease knowing that, I had a donor, very, very healthy. There was one last test and it was just slightly off and they said, no. That felt great to me because of course you don't want to put anyone else at risk to save yourself. And like Pat was saying, I sent out my first email and within 5 minutes, a friend of mine from the movies said, do you want mine? Can I give you mine? And he signed up and got tested and then found out he had some pretty serious medical issues to take care of, which he has. So it's really like a win-win. All of that medical care is free for the donor. If they transplant, all those expenses are generally covered by our insurance that's getting the leads. But also, if they're interested, they can call that transplant coordinator and they'll do a great job going through, making sure you're okay and what's involved. And it takes a while to get through all that testing. And anyway, it's just, it's impressive how how careful they are to make sure you're really, really qualified.
And both of you got the kidney not from family members, is that right?
Correct.
So, and that's important to always remember. So you can get a kidney donor from your family or biological related person, mom and dad, brother or sister, or any family members. You can also get a kidney from an unrelated donor, some a friend, a neighbor, and
A stranger,
a
even.
stranger.
Yeah.
We used to have what we call the non-directed donor or altruistic donor. That was the previous name. Somebody who was from nowhere come and want to donate to somebody. And they frequently start a chain of events of kidney donation. And we have also in the NKL, we have the voucher kidney where somebody who wants to donate right now, but the person who's going to receive is not perhaps in an optimal health status or perhaps not ready, they can receive a kidney at a later time, months or years later. So that also is a possibility. Was this very tasking for you guys? When you were in that process of looking for a kidney donor, did you have to spend a lot of time and logistics and financial to look for a kidney donor? Yes, walk us through the process. So in a simple steps of people who are living in, for let's say, in Gallup, or people living in northern New Mexico or in Roswell can understand.
This is almost like, how do you get the word out, kind of a thing, like, yeah.
For me, my transplant center was a Presbyterian hospital, and they do the NKR, National Kidney Registry microsites. And so that's one of the first things I did. And then they give you the website and URL and the QR code and everything like that. And you could put it on Facebook, and I did. I don't post on Facebook much. And, getting out of my comfort zone, I posted this. And friends from other states responded and said, I want to help. And they called in and they got tested. Unfortunately, one of them had kidney stones. Another one was taking too many blood pressure meds. And so they weren't able to donate, but the word got out and they tried, and you just keep trying and trying. And so that was a really good means of getting the word out. That is using the NKR microsite. And I used that a lot of different ways. I shared it with people, gave people my cards, and that helped spread the word. And so it kind of helped do a lot of legwork for me. And it didn't cost me anything except getting out of my comfort zone, which I probably needed to do anyways.
Right. I mean, I'm very fond of saying I work in the movies. And I have a lot of friends who wanted to help. So, I came up with Scott needs a kidney, and of course I had to make swag. On the back it says Scott needs a kidney, and then we used it for need a kidney because Craigslist is not an option. And then I had t-shirts.
My goodness.
Scott needs a kidney. What I should have done is put the QR code
In the back.
on the back. Because they're like, okay, you need a kidney. Like what do I do? And then I had a sign in front of my house. This is just the Y from kidney. And I mean, I kind of went nuts on the pitch. And that sign in front of my house, literally like your neighbor across the street, he said, hey, I saw your sign, what's going on? And I said, I need a kidney, which is what the sign said, I need a kidney. And he goes, what do I do?
Wow.
Also, in terms of it just spreading on its own, the sign led to a journalist from KUNM. They were walking through the park, and his girlfriend said, you need to leave your card because that sounds like a story. And he put me on the radio when I was looking, and then put me on the radio again after the transplant. But taking it back to something way more simple, because I had banners flying over Balloon Fiesta, because I have a balloonist friend who was like, well, I'm gonna put a banner on my balloon, and
My goodness.
if someone donates, I'm gonna give them a free balloon ride, on and on. But if you are in a more isolated area, your community is smaller, you're very, very shy. After all those pyrotechnics and all the marketing and swag, the way I found my donor was a Facebook post. And that really spread. And the older folks who are on Facebook are the kind of people who are ready to make a decision like, I'd like to donate a kidney. That can be one of the most powerful first steps, is just a Facebook post. If you don't use Facebook posts, if you don't use Facebook, I'm sure there's someone in your circle, a younger person, like our production assistant who's off camera here looking at the chat. Shout out to, how do you say your name again? Zoheb. He's doing an amazing job over there. Kind of running the show. There's someone who could help you with just a simple Facebook post. So it can start small, and then it kind of goes from there.
And I heard you, both of you said that when you went to the National Kidney Registry or the NKR, you were assigned a coach. Can you elaborate more on that?
Yeah, they just assigned me this coach, and we
You
set
have to
up.
pay anything for it?
Nope, didn't have to pay.
The whole
anything.
thing is free.
The
Oh, wow.
whole
Okay.
thing
Yeah.
is
So
free.
you just have to need a kid.
Yeah.
You just have to be listed.
Oh, you have to be listed.
Yeah,
Yeah, you have to be listed at a local transplant center first.
right.
Okay.
Right.
So that's always job one.
Okay.
And so I was assigned this coach, just the name of this lady, and we had a telephone call. And my wife got on the call with us, and she just told me, she, by the way, had a kidney, she had a kidney transplant 6 years prior. So
Mhm.
she's been there, done that.
Okay.
And she said, Pat, this is what you need to do. And she told me in no uncertain terms. And so it was really good. She kind of pushed me. And so I wrote up a story, and she gave me some guidelines to follow. She had me send her a bunch of pictures. So I sent her that typed up story. I sent her the pictures. She said, no, we'll use this picture. We won't use this other picture. And she marked up my story quite a bit. And then we got it all ready. And then she put it onto my microsite, which is my own website.
Right.
And I had a QR code like the one Scott just showed. And they gave me a box of cards that had my name on it, had the QR code, National Kidney Registry. And I could hand those out,
Oh,
and
so
people
handy.
just scan it
Great.
with their phone, and it comes up.
And once they do that, they can then repost.
They can send it on.
I ran into
right.
so many younger folks
Yeah.
who were just, I was gonna hand them the card, like, no, I'm good, and they just scanned it. Right, like, don't you need this piece of paper? Like, no. And then they would go from there.
Yeah, right.
Your personal site with your photos. And
Right.
the other thing that's so great about that National Kidney Registry website is it has all the information that it would be very awkward for you to try to explain, like the benefits, or all of the ins and outs of
Right.
and how to get in touch. And they kind of take it from there once someone visits the site. And there's different levels of participation in New Mexico depending on which transplant center you're at. But yeah, it's an amazing.
And there's when they go to your website, there's a link that says, are you interested in being a donor? And they click on that. Like Scott said, it gives them more information. And finally, there's a place to click if you want to donate, and it connects them to someone. And that gets the process started.
Right.
And your coach were not in New Mexico, they were from elsewhere.
No, mine was in New York.
New York.
And that for me probably was the most relieving part about it. There's something, for me anyway, being in my situation, that did feel isolating. I mean, I live in a big city, but my diagnosis felt isolating.
Why?
I think for me, it's personal. I don't know if shame is the word. There's some embarrassment a little bit about like, boy, I need a lot of help. You know, I think we like to feel like we're independent and make our own and feel very vulnerable talking to people about a need that's that great. But being able to talk to someone who had been through the process gave me a lot of hope. That's that advocate that Pat was talking about, who can guide you through what can feel like an overwhelming process.
And the advocate doesn't have to be a family. Because many times I say I don't have family, a friend, or in this case, perhaps the coach, right?
Yeah.
Very good, very good. What would as you were walking through this process, and when a donor went to a transplant center and did not get approved, how did you feel? Was it how do you handle those times?
Yeah, that's a really good point, because there's really a lot of ups and downs through kidney disease. And you get listed and then you're waiting to get called and you don't get called. And even when I was listed, I did get called. I waited a couple of years, nothing happened. And so you're waiting, and in the meantime, a couple people tried, a couple of living donors, some friends who wanted to be living donors, they tried, and you kind of get your hopes up, and then it turns out they were denied, and so your hopes kind of fall, and so it kind of goes up. There's ups and downs, and you just persevere and keep going on. And this is where that original friend I talked to, I would keep going back to him, and he would say, yeah, you just keep trying, and so we kept doing that. I got called once for a deceased donor kidney, and they tell you to have a go bag, with your pajamas in it, your pills and stuff. And so I grabbed my bag, I went down to the hospital, got a bunch of blood tests, and then they said, well, it turns out the kidney isn't viable. And so I went back home. And so a little bit disappointed. And then nothing happened for 6 months. And I was out to dinner with my family, and I got a call. And they said, we have a kidney for you. Can you come down? And I went down to the hospital, went home, grabbed my go bag, and went down there and got tested, everything. And then they said, well, the family decided not to donate the organs. And I could understand, there's a grieving family, someone had just died. But I was a little disappointed too. But then you just keep doing what the doctor says, keep doing, going to dialysis, even though it's not much fun. You keep drinking 1 liter of fluid a day, even though you're much more thirsty. And you keep trying to do the right things, and keep getting your story out. And eventually with me, a donor came up, and we got a transplant, but it took a while with a bunch of ups and downs.
Thank you for sharing your story.
So I had this sign in front of my house. And my wife was kind of like, that's a little bit personal, isn't it? And we did have a couple of interesting encounters. Like there was a woman who knocked on the door, and she said, well, I have a kidney. Now you need a kidney and I need a house.
Oh my God.
So it doesn't really work that way. See you later. Literally.
Right.
It seems like a fair swap. But in general, so I was happy that she didn't work out. But in general, specifically Christmas time, I get a card on our stoop saying, I saw your sign. I would like to help you. It's like a single mom. So she went through the whole kidney testing process, and she was almost there. And she sends me this text saying, I'm so sorry. I didn't pass the last test. This is what I was trying to say before. There was some slight thing that was wrong. And I was just like, never apologized. Like, are you kidding? I was so moved by it. I don't even think I was sad about it. I was just so moved that, I mean, she's apologizing for, you know what I mean? The hardest part for me was once my donor had been approved, I had about a month or a month and a half to wait while I was on dialysis before we'd have our surgery. And I was terrified that something would happen to her or something would happen to me. You know what I mean?
Right,
Like that
right.
last month or so was the hardest. It was very surprising. Yeah, and I think we have about 15 minutes left.
Yeah. And I
Okay.
think that just to
Yeah.
wrap up what you said, on those situations, that's when you have the voucher program, you know, when the recipient is not ready for whatever reason, you know, or
Right.
medical is not reason,
Right.
then the other can still go on ahead and then the recipient will get a kidney at a later time.
Right. Unfortunately, the donor could not.
Oh, no,
Yeah. So
Okay.
she had been, but yeah,
Right.
but the whole voucher thing too is great with NKR because, like, so my donor now has a voucher for her family. So if someone else in her family later on
I see.
should need a kidney, they use that voucher to go to the head of the list. So they,
true.
anyway,
That is
yeah.
true. And that is right. You know, so if you donate a kidney and there is a slightly higher risk to have kidney disease in the future because you have only one kidney left. But if you want to develop kidney failure, the system will allocate the kidney because it's, you gave a kidney priority to the system. Great. No, this is excellent. What time is now?
It's about 1:45.
Okay, very good. So let's start with some questions. Do you have any questions, Z? No.
Okay.
Okay, so we can maybe continue for a few more minutes.
Have we said the title of this? Have we said what this title is? Did we ever say meet a kidney?
I don't think so.
Okay, so we're gonna introduce the webinar at the end. So this is Meet a Kidney. Let's talk and laugh about finding a donor. And I think we even had at one point, because Craigslist is not an option. So yeah, just to kind of refocus on that.
And this is going to be a series of webinars. This is our first webinar. We are starting on learning this, how to do it. And we're going to run this every year. So we can do this every 3 months. So the next one is going to be sometime in July, late July. Okay, so we're going to have a different topic in each webinar, and you are more than welcome to join the foundation, send us your feedback, and so we can learn more about how to improve this program.
And which foundation is that? I don't think we have said that either.
The New Mexico Kidney Foundation.
The New Mexico Kidney Foundation.
It's a nonprofit. No, we've been here for the New Mexico Kidney Foundation started in 2015, and we have been running education programs in the community. Our main goal is to prevent kidney disease or to improve awareness about kidney disease. And for those who are in need for a transplant, we have 2 programs. One program that supports some grants for dental workup. So sometimes you are in the kidney transplant list and you need to get a dentist and you cannot pay for a dentist. So we have some grants to help with those costs. And the other program is this one. So we're going to start this education program because one of the barriers that we see many times is how to ask, how to find a living donor. And I think that's the key part that we want to stress.
We were talking about, Z, are you trying to tell us something? Oh, okay. The kidney coaches or the advocate who can help you better tell your story or get you out of your comfort zone or fly a hot air balloon for you. Trusted friends. What we would really like to be able to be is maybe that person that has been through it, kind of almost like a kidney coach for anyone who wants to tune in, to people who had suffered through dialysis, know what that's like, how hard that is, and had found a way through it to recovery. I know when I woke up from my surgery, immediately, I don't know about you, Pat, but for me, immediately, I literally said out loud, I feel like I can do anything. Like,
Yep.
I like to tell people that having a working kidney is really pretty handy. It just is completely transformed my entire life. And I also woke up feeling like I want other people to experience this miracle. And that living kidney starts working on the table. I mean, when they see it start, when they hook it up and it starts peeing, everybody cheers. You know what I mean?
That's true.
As opposed to from a decedent, it can take a while. So that's the other more emotional reason while we're here, is to kind of build community. Those folks who are feeling awful on dialysis, those folks are in tiny towns. This can be a place to come to maybe get some encouragement, some practical advice on, here's some ways to maybe start to make things better for yourself.
You talk about waking up after the surgery. I woke up and you got a bunch of tubes hanging out of you and stuff, and so it's not super comfortable. But you know what my wife said? She said, I saw color in your face in the first time in years, and I hadn't noticed that, because it's just a slow decline. And, you just kind of get used to the new normal of living on dialysis. And then all of a sudden there's a big old change, and she noticed it right away. And she said, there's color. I can see some red. It's not this ashen white, and so.
You're right. You're absolutely. If we have to give some take home points here to our audience, what would be our advice? This I would use.
I would say, start getting the word out early, and rather than later. It's just important to not wait, to start, sharing your need with people. Of course, like Scott said earlier, it's important to get listed. And, but once you're listed, start getting the word out that, you have this need, and don't wait.
Yeah, I mean, exactly. I had been on dialysis for several months before I heard about living donors. And there are these really sad stories about people who also didn't know about it and then did not start their search in time and ended up, dying as they had put the word out. So yeah, getting started early. I think another second step would be working with your transplant team, your living coordinator, even prior to getting registered on something like the National Kidney Registry, to be able to pass out their phone number. Right. So people, if they're interested, they can, decide and then talk to them and then get that going. But I think we would both advocate as well for once you're listed locally, getting over to the National Kidney Registry and working with them as well, because then your reach is increased and they give you all those great tools that can make, asking easier. When I asked my donor why she decided to donate, she said this amazing thing. She said, well, you needed a kidney and I only need one. And that's probably the simplest version of it. And she just kind of knew that. And that's kind of what, living kidney donation, that's the miracle, that's what makes it possible. Then I think the last thing we were talking about was help early on, even when you're just thinking about getting this started. Talk to a friend, talk to someone at church, talk to somebody at work. and get that outside perspective on maybe how to take some of the first steps, because it really can feel very overwhelming.
Again, everything starts with getting yourself on the list.
Yes,
That's the first step.
get on the transplant list.
You know? Yeah. Very good.
And I have friends that are trying to get on the list, and the doctor says you got to lower your weight, you got to get a lower BMI, lower your blood pressure. So sometimes there's some things you have to work on, and I would just encourage you work on those really hard to get on that list. Whether it's losing weight or making sure you're taking all your meds and everything like that. So I would just encourage it. Just do what the doctor says.
And one of the things that, thank you for stressing this part, because being on the waiting list is not a static process, it's a dynamic process. So let's say, for example, April 26th, next week I get on the list myself. So, but if I get a pneumonia 3 months later, I'm sick in the hospital. So this inhibitor may put you inactive temporarily until you get over the infection, and then you get back on the list. And any different transplant centers have different policies. Every 1 or 2 years, we have to check the file, we have to check some scans, do some blood testing. We just have to ensure the recipient is going to be in an optimal condition to receive a transplant, because it's not only the surgery, it's also the medication that we use to keep the kidney transplant going. And those medications do have some side effects.
Right. And I mean, if you're on dialysis, you're not that healthy to begin with. And so then trying to stay healthy to then get the transplant, to get healthier, all of that's a huge challenge. And I think, again, do you have someone you can reach out to who will take a walk with you? Do you have someone who can help you with meds, all that stuff? Because just sharing that burden is just so much easier than trying to do it all yourself.
That's true. That's true. When you set up your journey for a transplant, do you see that getting a living donor was unachievable, was very far away? When you first envisioned this?
It seemed impossible.
It did seem impossible.
To go and ask someone for a kidney. And of course, that's not what I ended up doing. I was coached by people who had been there that said, you don't ask, you just put your story out there. And people that want to donate will try to donate.
Yeah, exactly. The whole thing about because Craigslist isn't an option. I mean, it felt that impossible. I mean, I remember we were at a church meeting, and I was about to tell my story, and I felt like a vampire because I was looking around. I'm looking around. I'm like, now that one, she looks like she's about 24, super healthy. Just saw her running around the park. Now that one I really need to talk to. And it just is not like that. What came about from that was I told a brief story, and then all these young people came and they scanned my thing, and a few of them got tested just by saying, essentially what you're saying is, I need help. And what you'll find is someone out there saying, I want to help. That's how simple this is.
Scott shared the story about what his living donor told him, and my living donor told me the same sort of thing. She had to go through all this testing, and then COVID hit, and so we couldn't do a transplant. And once COVID lifted, she went through all that testing again. And I said, gosh, I'm so sorry, you got to go through all this testing, 24-hour urines, all sorts of hard things. And she said, no, Pat, I want to do this. And that just opened my eyes that there are people that are so giving, they just want to do this, and so it's our responsibility to get our story out, and there's people out there that want to give, and want to do this.
This has been a great session. Any questions, Z? No questions? All right, very good. So I think we're wrapping up this.
All right.
This is
Okay.
great. Thank you very much for coming today.
Yeah.
Thank you
All right.
for
This was
our first time.
our pilot
Okay,
episode.
we'll see. Thank you very much. Okay.
Thank you, everybody.
Thank you.
Bye-bye.
That's fun.